Hi, I'm Jack West, medical oncologist from Swedish Cancer Institute in Seattle, Washington. I'm recently back from the World Conference on Lung Cancer in Yokohama, Japan, where one of the more interesting presentations was by Dr. Ferreira and colleagues from the Institut Gustave Roussy in Villejuif, France. They talked about this situation called hyperprogressing disease, or HPD as it is sometimes abbreviated, that is this concept that patients may demonstrate an accelerating rate of progression in certain situations. And this has really been looked at now in the setting of immunotherapy. In fact, that group from Institut Gustave Roussy first described this issue of accelerating progression or hyperprogressing disease in immunotherapy in the last couple of years. And many of us who treat many patients with lung cancer have seen this in a subset of our patients. The challenge is this really more common in the setting of receiving immune checkpoint inhibitors than we would see in patients who got chemotherapy or targeted therapy or were just observed? Now, we do know that some patients just show an accelerating rate of disease over time and treatment. So is there something specific about immune checkpoint inhibitor therapy? Now, just to give you a better sense of what we're talking about, there's a figure from that presentation that shows the progression of disease. Basically, time is moving from the left side to the right side, and an increasing burden of cancer is shown as a line going up, and a decreasing volume of disease is shown as the line going down. So before they start treatment with immunotherapy or say whatever treatment, that start of treatment would be that vertical line, the blue line, about 1/3 of the way in. And you can see that before that time happens, the line is going up. That represents progression of the disease before starting the treatment in question. Now, if the treatment is ineffective, the cancer will just progress at the same rate. That would be shown by the blue line going up, PD standing for progressing disease. If it was maybe a little shrinkage, it would be the purple line that's basically straight horizontal or slightly going down, SD, stable disease. You can also ideally have the tumor shrinking, which is shown in the green line going down, PR being a partial response. Now, there's a few other lines there. You can see the situation of pseudoprogression, where the line is initially going up and then follows the trajectory of the yellow line going down. And we do see this in a minority of patients. It's not common in lung cancer, but sometimes you can see the visible lesions increasing in size and then shrinking after a delay. And that is pseudoprogression of disease. But then that bar or the line going up that is red is hyperprogressing disease. And that is now the disease is progressing but at a faster rate. So that's the situation, and this particular study looked at patients with advanced non-small cell lung cancer in a large retrospective study from several centers in France to assess the actual frequency of hyperprogressing disease, comparing it in patients who received immunotherapy to patients who received conventional chemotherapy. Now, this slide describes the actual definition that they used, which is carefully looking at the volume of the measured disease, both before the start of treatment with immunotherapy and then after that, and then just looking at the rate of change, and specifically, was there a greater rate of growth? And hyperprogressing disease was defined as a greater than 50% increase in the rate of progression once patients started on immunotherapy. What did they see? Well, they saw that 14% of patients who received immunotherapy followed this pattern of hyperprogressing disease. So it's not a common situation, but it's still more than we would actually see with immunotherapy, where it was actually 5% of patients who had that pattern. So we can see this with chemotherapy. We do observe this, but it's quite a bit more common in the setting of immunotherapy. Now, you could also ask whether this had an impact on survival, and it does seem to. When they looked at the patients who demonstrated hyperprogression on immunotherapy, there was a worse survival in these patients compared to the patients who did not have hyperprogression. In contrast, in the patients who had received chemotherapy, when they had hyperprogression, there was not the same impact on survival seen. Now, that was a smaller subset of patients, but it does suggest that there may be something particularly challenging and worse about patients who develop an accelerating pace of progression on immunotherapy. And in this first characterization of this observation that we see in the clinic, it is about 14% of patients. So where does that leave us? This certainly doesn't mean that we should not treat patients with immunotherapy, that it's necessarily a dangerous thing, but it should give us a moment of pause that not all patients benefit from immunotherapy, and some may actually be harmed by it. It does suggest that a significant minority are actually going to be harmed. The challenge is that we can't identify right now which patients those are. It will be a great benefit in the future if we can better identify which patients are most likely to benefit and which small subset of patients are actually potentially going to be harmed by immunotherapy and should either not receive it at all or should have it deferred until as late as possible. This is really a very early step in studying this issue, but the group from Institut Gustave Roussy should really be congratulated for initiating this careful study and getting us started on learning more about this problem and hopefully being able to address it better in the future.